Welcome, everybody, to another episode of The Root of the Matter. I am your host, Dr. Rachel Carver. Today, we are happy to have Dr. Scott Vrzal with us today. Dr. V is a doctor of chiropractic, doctor of applied kinesiology, amongst some other things, maybe. He talks a lot about the mind-body connection. He has a great new book about headaches, which I'm really excited to dive into this topic. So maybe, Scott, just jump right in and let us know, what brought you to chiropractic care in the first place?
Yeah, I started young with the pursuit of health and wellness. I realized early on I was diagnosed hypoglycemic. I was starting to work out in the gym at that time, but diagnosed hypoglycemic after I passed out at a large event with a lot of people around. So I quit eating sugar at 14 when I realized the consequences of that, which is a lot of your dental listeners are going to celebrate, right? I wish I could bottle that so everybody else could say, hey, take this pill and you'll never want sugar again. That was a big change for me. So as I started modifying my diet and realizing how what I ate made a difference, I just got more and more obsessed about it. And then I had my first chiropractic experience that really for headaches. My headaches at that time were a headband, whole head type of a headache that I now understand was a colon issue, but I got adjusted for that. And that kind of rocked my world. I felt completely different and empowered. And I'm like, I want this for me and I want it for everybody else. At that point, I had done a self-interest test trying to find my way as a young lad. And chiropractic was actually one of my highest scores because of my interest in physical health and nutritional health. And so as I dove in, it was far and away, for sure, my mission.
I think it's interesting, how we tend to think of chiropractors as people focus on the back, but in all my studies and really into the whole cell core, which was first two chiropractors who formed that company, that really chiropractors are so whole body health, is that part of every chiropractor's training that you're learning more how everything is interacting?
We're all a composite of our experiences, our life experiences, right? And so, yes, chiropractic is the structure function foundation. And within that, there's many avenues and directions that it can go. I personally took on a position to bring on the leaders in the profession during chiropractic college with the intent of figuring out who was the most effective and most efficient. And ultimately, that led me to several techniques, but applied kinesiology was the approach. Dr. George Goodhart, and he talked to a lot of dentists as well with his teaching, the late, great Dr. Goodhart. We lost him a few years ago. But so he brought in the muscle organ correlation, which brings in acupuncture and nutrition and emotional work, puts it all together with the structural function, and it's applied kinesiology because it's the study of movement. And so every muscle he deemed had organ associations, and most of those are because acupuncture meridians go right through there, much like the teeth. So then if the person is having trouble raising their shoulder, we look at the prime movers or the muscles that are going to initiate that activity. Realize if your deltoid's not functioning right, we need to look at your lungs, or your supraspinatus is not initiating the movement. We need to look at brain function or brain chemistry for you. And so it gives me a very profound tool that makes it very simple to just point to where it hurts or show me what you can't do. And I can tell you what the organ association is. And then we look at, is that weak? Is that organ weak because of a structural problem? Chiropractic, PT, that sort of stuff. A chemical problem, meaning something they're eating or something they're exposed to. Or is it an emotional problem? And so organs all have specific emotions associated with them as well. But it gives me a tool to prioritize and figure out where a person needs help. And that's ultimately how I was able to identify whittle it down to 7 specific patterns of head pain, for example.
Well, this is really exciting. So those of you who have been listening to my podcast for a while, we've talked about muscle testing before. It's absolutely fascinating, right? And most of the time we have an ache or a pain, right? And we take some ibuprofen and, whatever. Oh, well, I'm getting older. I'm supposed to have arthritis. And then we go to our conventional MDs, right? And they're giving steroids or other stronger anti-inflammatories without actually looking at what's the root. My patients, when I'm seeing arthritis, I'm thinking some kind of inflammation, right? And I put a lot of people digestive enzymes. Going, wow, I just feel better. Yeah, a lot of times you're not digesting well, but again, certain areas of the body. So when we can understand the foundation, the root, right? Hence my podcast, then we can say, okay, like you said, the headband that was related to the colon. What can we do to ensure that the colon is happy and healthy? I know I have this one tooth that bothers me every so often. There's no infection, but that's on my large intestine meridian. So then starting my intestines, I'm like, ooh, it's wintertime, it's getting drier. I need to make sure I have good hydration, good fiber, getting my electrolytes, making sure I'm having good bowel movements. And lo and behold, the tooth gets better. So I think sometimes doing conventional medicine and dentistry, we dive right in. Oh, there must be something wrong with the tooth. Let me drill it out and do all this. And then are you making a bigger problem, right? Now we're putting in, using all these chemicals and all these things, and that's not really where the pain is coming from. So the whole idea behind the meridian is that everything is connected to something else. So we really, somebody like you, like me, we're sinking a little deeper, right? What's going on?
Yes. And he covered a lot of wonderful material there already. I'd love to lean into the enzyme issue a little bit and maybe shine some light in a slightly different way on the enzymes. 100% enzymes are necessary to help facilitate digestion. Potentially less known tool or way to use enzymes is a natural anti-inflammatory. So if a person's having that dental surgery, having surgery, the protocol is to first, let's shine light on the fact that enzymes with food help us digest the food and the protein of the food. If we take them away from food or away from protein, then they digest the inflammation and the protein of the breakdown. So we take them away from food and they're a natural anti-inflammatory. They facilitate collagen healing so that the fibers will line up properly instead of being the mishmash that creates the scarring. And they also help facilitate clotting. So if somebody had gotten to the end of their rope for alternative medicine, nothing else has worked, now we have to pull the tooth, so to speak, then notice I'm reversing the alternative medicine. When everything else fails, then alternative medicine should be surgery. So if we get to that point, take the proteolytic enzymes, good high protein, and Cellcore has great ones. We take that proteolytic enzyme typically about 1 or 2, 3 times a day, the day before. And then my protocol is typically as soon as you wake up from the surgery or as soon as you're done with the surgery, you start popping 1 to 2 per waking hour away from food, typically for about 2 weeks. And so that will drastically facilitate the healing process. And there's countless studies that show that it literally cuts the healing time in half. So people, and typically right about that 2-week mark, if you're taking too much, you'll get that burning, that epigastric, that burning right at the bottom of the sternum. Means, okay, we're pushing the enzymes a little too hard. And that would be the time, that's usually right about 2 weeks. Then that would be the time to start backing down the enzymes maybe 2 to 3 times a day as the inflammation comes down, as the healing process has completed. So that's a real nice tool for this type of audience, and especially for the dentists and orthopedic surgeons I've shared this with, and every patient I've had that does this protocol and then goes back to their doctor. What are you doing? How'd this happen? How'd you get better so fast? And the reality is it works so well that most of the time people don't even need pain medications. And when we look at anti-inflammatories and pain medications, most of them inhibit the sulfation pathway in the liver, and think, what do we need to heal and recover? Is that chondroitin sulfate, right? If you have chronic joint pain, people are taking chondroitin sulfate, or glucosamine sulfate. We have sulfur. Those are all sulfur-based regenerative tissues, and that pathway in the liver gets shut down by anti-inflammatories and pain medications. So if we can use the proteolytic enzymes, that facilitates that healing process, and that's a lot of how we can minimize scar tissue. And literally, if you realize, oops, it's been a couple hours, you start getting that throbbing, pulsing pain around the area where you had the surgery. Typically, take the enzymes away from food, and usually within 10 to 15 minutes, the pain goes down. And say, okay, there's peace in the world again.
Awesome, and kind of taught me something new about how using the enzymes after surgery. But you make such an important point. And when I'm doing extracts or minimal surgeries, we are using ozone and laser and red light and arnica. Like I totally agree with that. When we take any kind of NSAID, ibuprofen, Tylenol, you have to process that through the liver. The liver, 9% of us is completely overworked these days because we are bombarded with toxins. There are children today who have fatty liver disease. It's interesting that you say that, right? You stop the liver from being able to do all of its healing processes. So, before my patient, the numbness even wears up, I'm popping arnica, and I have them take that twice a day for 5 days. I was just saying this to a consult earlier today. I can't remember the last time I had to give somebody ibuprofen, let alone an opioid, because all of these different therapies are enhancing the body's way of healing versus these kind of drugs, which are necessary. Absolutely. Sometimes we need that. If we can prepare the body properly and keep stimulating its way to heal, you do so much better. It's amazing. So enzymes, that's a good tip. I may add that to my little protocol, because that's what we're doing when we're taking out teeth. We want to encourage the collagen and everything to grow in that bone to fill in more quickly. So yeah, that's super exciting. So why don't you talk to us a little bit about your new book and talk to us about headaches? We have a lot of patients who come to us and I think it's joint related or clenching or whatever it is. So I'm really fascinated to learn about how the different areas of the headaches are connected to different areas of the body.
For sure, we can go all day. So yes, we can talk about headaches. We can lean into the TMJ and ask kinesiologic perspectives on TMJ as well. Yes, ultimately, I whittled it down to 7 different patterns of headaches. And the reason the book is called The Headache Advantage is, for me clinically, the advantage of the location of head pain is it really tells me the priority or the primary weakness for that person. And so they may have a list of dental problems and digestive issues and hormonal issues. And we go through that whole list, and the location of that headache tells me this is where we need to start. So typically, if they have a whole head headache, as we talked about potentially for your daughter or some of those, whole head headache, I know we need to work on the colon is your primary weakness, if you will. So we need to look at what it's going to take to heal and facilitate the colon. So those 7 patterns are, on the right side of headache is a gallbladder problem, and right side of headache is gallbladder, left side of headache is a stomach concern. Frontal headache, you can picture the person hand on the front of the head. That's production of cortisol, or basically stress inhibiting digestive function. So in other words, think ulcer, that's the frontal headache. So those are very common with us go-getters. And then we've got the bitemporal headache. That's typically estrogen metabolism. So temple pain around the ears on both sides. That's going to be your hormonal headaches, ladies. And then the back of the head headache is thyroid concern. That also comes back to enzymes often, because part of the way the thyroid activates metabolism is to activate digestive enzymes. That's part of how it stimulates metabolism. So when that process is compromised, that'll set up the tension headaches in the back. And then the other one is what I call the cyclops headache, or the third eye type of a headache. And that's typically a pituitary dysfunction. I think I covered all 7, right? 1, 2, 3, 4, 5, 6. Did I miss one? Whole head.
The temples,
Tension.
I think you know.
Yeah. I think I covered all 7.
Yeah. So fascinating, because again, they're just like, oh, just take your Tylenol and you'll be fine. Okay, maybe it's like a Band-Aid, right? It's just the thing about most conventional pharmaceuticals is that they suppress your symptoms, right? And that can create, make the problem deeper and deeper and deeper, which means it's harder and harder to uproot the cause. I remember my daughter, she got a small little scrape on her leg and she started picking at it and ended up getting a staph infection. And I was like, no, it's fine, but it started to get bigger. And I thought, if I took her to the ER, they're just going to give her antibiotics and steroids. And I really don't want to push the infection deeper. So, I was like, all right, let me get out all my tools. And I got the ozonated olive oil. I used ozone gas. I used a binder on it. And yes, it took longer. It took 10 days for it to go, where with antibiotics, maybe it would have been gone in 2. But she healed. And I felt better that I didn't suppress.
You strengthened her body instead of crushing it, instead of inhibiting its natural function. As a sidebar, oregano is the typical herb that I would jump to for staph. It tends to be a nice drying herb and facilitates healing and sulfation and gut biome. So just for future reference.
Yes. Oh, that's fabulous. She's had a couple of skin issues there. So these little tidbits, because, a lot of people who are listening to this are looking for more of the naturals or more of ways to stimulate the body to heal. So all of these, we've already gotten such a hand of good tips already. So this is exciting. So tell me your perspective on TMJ and what, there's a lot of thought that a lot of it is emotional, right? We just say it's in your head and just de-stress.
Yeah, so de-stress is part of it. If it's bilateral TMJ, or those jaw problems on both sides, think of the jaw as basically a free-hanging structure, right? And so it's supported by muscles. And so ultimately in kinesiology, we look at the foundation. That foundation is the pelvis. So if we build our house on the rock and we have a solid foundation in the pelvis, then the jaw hangs properly. Typically stress, the chronic cortisol, ultimately it ends up being adrenal insufficiency or stage 3 or crashed adrenals. And that causes a posterior ilium, in other words, a rotation of the pelvis. So then the foundation is now crooked or on the sand, and the jaw will get tense, and we end up tension in the masseters and the pterygoids and that sort of stuff. And so people will work locally here, try to change the bite without correcting the foundation. And so then we're correcting the bite into pathology, unfortunately. So we want to correct the foundation, help them handle stress. Often clinically, that means glandulars, I often find, adrenal glandulars to help heal, strengthen the tolerance of stress. Other physical symptoms that would go along with this temporal bilateral TMJ weak foundation is going to be medial knee weakness because of the muscle weakness, the sartorius muscle that goes from the front of the pelvis to the inside of the knee, and the gracilis. Those are both muscles that will get weak and compromised when the adrenals are weak. And so that's what causes that pelvic rotation. So in addition to that, we have the medial knee weakness, we have plantar fasciitis, the collapsing of the arch, bunions, weakness in the ankles. Those are all physical manifestations of this chronic adrenal symptom as well. So if you have some of those, the reason I bring this kind of stuff up is then it's, check, I have these. Stress is the trigger for my jaw. And that's how I try to lay it out in the book too. If you have we'll talk about frontal headache. There's checkbox surveys, if you will, of symptoms that might also be associated with this, so that a person can look at that and say, yep, that's me. What's the solution? These are adrenal glandulars or herbs like rhodiola, like some of the different like Panax ginseng, things like that can help facilitate adrenal function, work really well. Conversely, for the frontal head, and I'll get back to the other unilateral jaw problems in a sec, frontal headaches typically is going to be the opposite type of an adrenal herb, ashwagandha, that's better for the overzealous cortisol response. And to bring that up, because ashwagandha is getting a lot of press these days, and it's a super popular herb. Makes sense. Most of us are overstressed, especially this time of year. So that's the adrenal pattern and putting things together there. So if it's both sides of the jaw and we're having bite problems, sleep apnea, that's also tends to be an adrenal problem. So if we're working on that for the jaw, we want to help the person handle the stress better. And then maybe it means getting off coffee. Corn, unfortunately, is a food trigger that will cause cortisol release. That's something that a lot of people are unaware. Corn will also cause ovarian cysts, ladies, which could be a bitemporal headache. So those are some of the food triggers we might want to consider. If a person's I look at blood type, that does have a lot to do with how the immune system responds. O blood types really don't do well on coffee. So if a person's doing too much coffee, that can be the adrenal stressor and set up the jaw pain. A blood types, fortunately, can get away with a little bit more coffee and be okay. So that's the art of healthcare, and taking advantage, getting to the root of what's going on. So that's the bilateral jaw. If it's a right-sided jaw, that goes back to what I talk about as with the right-sided headache, that often is going to be a gallbladder concern. If all their quote jaw pain is on the right side, then we want to look at what's going on with the gallbladder and compromising, referring pain to the right side of the head. So incidentally, right-sided sinus, right eye issues, right headaches, all of that tends to be a gallbladder concern. And I'll throw that out to you. Which tooth would be a gallbladder tooth in your world?
So
Which
that's
one is that?
the canines. I had like our pointer teeth there. I'm
Right,
like
or
furiously
some-
taking notes here. This is like learning
Awesome.
great stuff here. This is amazing.
Great.
Yeah, and also about temporal being in estrogen. We tend to see more TMJ in young females. So something about the estrogen also affects, the joints and the collagen more. I think today's modern world, us women are supposed to be multitaskers, right? And should not be a problem. And again, with the hormone stuff, I don't know if our adrenals tend to get overloaded so often. Yeah, this is so interesting. And why I think it's so important that you work with a healthcare team, right? Because you're feeling here. So you come to the dentist, fix my TMJ. Almost every single one of my patients that have that, I want them to either see chiropractor, a craniofacial technician. I just had a girl yesterday and she said, there's a little itty bit here. And I said, okay, yes, the bite's off a little bit, but what else is happening? Do you have the shoulder and neck pain also? How much stress do you have in your life? You can't just fix one little issue, right? One symptom can be a broader issue. So you have to look at the body as a whole thing. And I think this is where we get tripped up in medicine and dentistry, because there's specialists in medicine now and dentistry that nobody's really putting it together, right? If you go see the endocrinologist, they're only going to talk to you about hormones, right? You go see the heart doctor, they're going to only talk to you about heart. They don't remember how it all, works. Yeah, this is why somebody like you and a lot of other my colleagues in chiropractor are, to me, more meaningful. Those are the people that I reach out to if I'm having a symptom or something, like, hey, help me run through the gamut of how is everything related? What are all my symptoms and how relate to each other? Because I think, again, that's how we get well. Right? I like what you said. When you're doing muscle testing, you're finding what's the priority. Okay, you've got all these symptoms and all these issues, but I use a lot of biofeedback and you can get a lot of information, but what do you need to work on first, right? Because if you don't go in the right order, that also messes up the body. It can throw the nervous system out of balance, right? I kind of think that nervous system is so important. This is why chiropractic is so important. When that spine and everything is aligned, energy flows through the body. And to me, health is all about having enough energy and having it flow properly. Right? And chiropractor is huge for when that spine's a little crooked or a little off, the body has a harder time getting the energy to the areas. And then, we have a symptom. I always think of when there's pain somewhere, there is something affecting the energy flow. So is it a toxin? Is it a physical damage? Is it emotional? There's all these different aspects to it. And we need to look at each individual thing in order to get complete resolution, in my opinion.
For sure. There's so much to unpack in there. And so my mantra there is pain is intended to elicit change, right? And so if the listener is having pain, that is your body yelling. It's your warning light on the dash of your car saying, need fuel, low tire pressure. So hopefully you're blessed to be in a position where you have a practitioner that can help you identify the cause of that pain. But if they can't, you and I are empowering these people to build your team, find somebody that can help you do that. Listen to podcasts like this that are going to help give you the information to find those answers. We need to be our own advocate. And as you mentioned, so much of, quote, medicine in the allopathic model is specializing in having more credentials to be laser focused on just this one area of the body and not look at what the body's really trying to tell us. So 100%, that's our mission in life, is to help people understand, find the answers out there. It's your body telling you. It's not something that, to just suppress and move on. And to circle back to finish up the left-sided headaches or a stomach issue, that's typically low stomach acid. So again, if you have all these other symptoms, the pectoral muscle will tend to get weakness on bench press. If you're lopsided trying to bench press, stomach acid is at its highest first thing in the morning. So if you have trouble digesting your proteins when you get started in the morning, or sluggish metabolism first thing in the morning, those are further signs of stomach issues. Left-sided eye weakness or left sinus, all those are further signs that the stomach is the priority. That's why I've got further questions in the book, and ultimately, hopefully, leading to the solutions to help person understand if they need calcium or they need vitamin B1 or zinc to help make stomach acid to eradicate that left-sided stomach pain. Then be empowered to find those solutions ultimately. Mm-hmm.
Yeah, that again, just absolutely fascinating. Speaking of that low stomach acid, most people that when they have reflux or these issues that they have too much acid because obviously they feel like a burning sensation. But we know there's so much science to prove now 90% of the time it's too little acid. So I try to explain this to my patients that valve that closes the stomach off from the esophagus is dependent on how much acidity is in the stomach. And if there's plenty of acidity, that valve can stay closed. If there's not enough, it can open. Other things that can affect that valve, but that's one of the biggest ones. And so when I see patients who are on these PPIs and acid blockers for decades, I'm trying to tell patients, there's a reason my God or universe or source or whatever you believe in created human beings to have a very acidic stomach, right? It's supposed to be that way to digest our big proteins. I think this is one of the reasons why a lot of people have sensitivities to wheat and dairy. Those are very large, heavy proteins, not to mention all the other antibiotics and other stuff in them. But it's more, if you don't have enough stomach acid, they're going to be harder to digest. And so when we shut off that acid, I ask my patient all the time, how are you expected to digest any of your food? And if you don't digest your food, how are you going to get the nutrients you need for your cells to function properly? And I just kind of leave it at that. And patient, I mean, you don't have to be highly educated or a scientific mind to be like, yeah, it makes sense on that low stomach acid. And a lot of times, like you said, it's you're missing certain minerals, right? And it's a catch-22 because if you don't have enough stomach acid, you can't absorb the zinc, right? If you don't have enough zinc, you don't make the stomach acid. So
yeah, and I agree completely. And so a couple things there. Yes, low stomach acid. We need the stomach acid to activate calcium. We probably should start the whole preface a lot of the conversation with what are the long-term consequences of blocking that stomach acid, right? So then we have those large proteins that are not getting broken down in the stomach. Those get through the leaky gut, then that sets up arthritis and all these the monstrous ever-growing list of autoimmune conditions. That's these large proteins leaking through the intestinal lining, not getting broken down properly. We need the stomach acid to break down to activate calcium. We need calcium to buffer the stomach. So there's another one of those vicious cycles, right? And then you as a dentist, right, if they're blocking that calcium, what's going on with the teeth, right? Then teeth are bones. We need calcium to make strong bones, obviously. So if we're blocking that stomach acid, what's going to happen to our ultimate dental hygiene? So the list is infinite of the consequences. So let's talk about what really is going on with that hiatal hernia. The heartburn that a person has often is a gallbladder problem. So I find helping, healing, correcting the gallbladder function, again, is also potentially going to manifest as a right-sided headache. The bile from the gallbladder helps us digest fats. The diaphragm is the most aerobic muscle in the body, so it needs those fats to be functioning. The diaphragm needs to expand and contract even while we're sleeping. And so when that doesn't work well, then the esophageal opening gets too large and the stomach slips up through. And so that's the symptoms. Blocking stomach acid may modulate those symptoms a little bit, but ultimately, that's my question. How have you been feeling since you started your PPI or your acid blocker, your Tums? Not so good. I have less heartburn. Yeah. So we want to fix gallbladder. One of the main offenders for gallbladders I found was wheat early on. Then I realized it's the glyphosate. It's the Roundup pesticide in the wheat that inhibits bile production. Unfortunately, it also obliterates the intestinal lining. But for what we're talking about here, we inhibit that bile production and we don't digest fats well. And that sets up that hiatal hernia. So consider your foods, your diet. Are you eating too much wheat, corn, soy, or oats that is laden with that Roundup, that glyphosate, which is very prolific in the U.S.? We travel to the Eastern Bloc countries, the European Union. Typically, they don't use as much glyphosate there. They don't kill the grains with those like we do in America. So we can get away with the grains potentially there. Or if you're a wine drinker, then get a European wine that doesn't have the glyphosate, unfortunately, because it's so used around in America. Most of the wines even are going to have glyphosate in them. So those are some triggers that are going to compromise the gallbladder, set up acetylcholine that is the brain's modulation of the gallbladder. That will go low when the gallbladder is struggling, and acetylcholine then would cause high blood pressure, high cholesterol, memory recall issues. So if we have some of these concerns, it could be as simple as chilling on the wheat or taking a beet-based product to help the gallbladder, help us make bile properly and reduce the heartburn and prevent things like Alzheimer's, right? That's a big win.
you just put so much information in that those few minutes that you just taught. And like my mind is spinning. I'm like, I can't write fast enough. Awesome. But super important. And I want to iterate what you said about the people say, I can't eat wheat, but I agree with you. I think the worst part is the glyphosate. That is known to inhibit like 600 different enzymes in our bodies. And so that is where wheat is becoming really, really detrimental. And like you said, it's everywhere. I don't even think really organic exists in our country anymore because it's in the air, it's in the water. Like maybe it has fewer pesticides, but it's truly organic. I just don't think it's possible anymore the way that the agricultural system is in the US. But this is really important. Gallbladder surgery is one of the most common elected surgeries done in the US, and it's completely avoidable. I mean, again, it's like, why did the universe create human beings? Why do we have a gallbladder? Expendable, then why did we have it, right? It's important. Certainly you can survive without your gallbladder, and a lot of people have the surgery and they feel better, but now we are compromised, right? We are missing, a key function to help us. And speaking of the teeth, right? Fat-soluble vitamins, the D, the A, the E, and the K are absolutely essential for healthy teeth, for good eyesight, for bone structure, right? Like we need that. And so if we can't digest or absorb those fat-soluble vitamins, and those fat-soluble vitamins work with the minerals like calcium and magnesium, to put the calcium and the magnesium and the phosphorus in the proper hard tissue, like our teeth and our bones, right? So we have to have all of these nutrients. And this is one of the reasons I think we have such chronic disease in our country today. Our food, we are overfed but undernourished, right? Because with all of the pesticides and the herbicides and the antibiotics and the food, the soil's so deficient, the food is so deficient. We are not getting those basic nutrients anymore because most of our food is high fructose corn syrup and glyphosate, and all of this highly or ultra processed food. And that, like you said, hey, if you're having a gallbladder, maybe we just stop eating wheat and corn maybe for, a month and see what the difference is. I mean, it's obviously easier said than done, but there's so many alternatives out there. It's, we have such a fast paced society now. Even I used to love to cook, even just 10 years ago. And now I come home and I'm like, I'm tired, let's get takeout, right? And I'm like, we really shouldn't, but I feel tired. So we've lost that art of wanting to cook or teaching our kids, right? Their home ec doesn't exist in high school anymore. We're not teaching our kids, maybe hopefully in health class a little bit, but things have really changed and everybody wants that convenience. We want that quick fix on everything, right? So it becomes challenging. But if we maybe can create this awareness, right? Maybe, people can understand. People don't want to feel, most people anyway, don't want to feel sick and tired. So if they know, hey, maybe I just don't eat wheat. That was the first experiment I did when I was trying to heal from my eczema. I stopped eating wheat for 4 weeks. And I'd been on one steroid cream. This was before I knew everything. I'd been on all the creams that didn't really help that much. 4 weeks off of wheat and my hands cleared 90%. So it's like, okay, well, that's some evidence here. I don't need to be sticking all these terrible immune modulating things on my skin. I can just tweak my diet a little bit. But, just switching things up can, like you said, as a kid, you realize, man, I wish my kids could understand that, switching up the diet, which they know in their heads, but it's, again, they're around all the bad foods and stuff all the time. But I'm hoping the groundwork is laid. So, when they're a little bit older, they'll understand that, right, and go back to eating the good whole foods.
Right. I call that the Bruce paradigm. I had a patient named Bruce. They came to me every other week, and he was an optometrist with dry hands. And every other week, I'd tell him the wheat is causing you dry skin. He had literally cracking on his hands. But I need to eat my sandwich for lunch. I'm like, no, you don't. Find an alternative. Literally 5 years we went through this dialogue. He finally cut out the wheat. Oh, it seems like my hands got better. I'm like, thanks for contributing to my kids' college fund. Glad you finally got the point.
I know when I first saw muscle testing, I was very interested in it. It was my chiropractor actually and then she was doing it all and she was like, okay, you need XYZ. And I was kind of like, I kind of believed it, but I wasn't on board yet. It took me a few years to be like, oh man, I wish I had listened to her back then. And I wouldn't have myself deeper in the hole, but everybody kind of comes to things in their own way. And I had to learn, as a doctor, a provider, a health coach, to learn how to step back a little bit and stop pushing. I'm the worst as a mother, of course my kids don't want to hear what I have to say. They push so hard. So I have had to learn over the years how to be like, hey, here's what I know, and take it or leave it, whatever. I'm here to help you on your journey.
And then they get their win and it inspires them to listen and, okay, what can I do to feel even better?
Right.
I'd love to lean in. You talked a little bit about basically leaned into the mental fatigue kind of thing, because that comes back to toxic metals, and mercury is a massive one in that arena. So just because I've recently enjoyed some benefit there on the mental fatigue frontier, or we'll call it brain fatigue ultimately. I know you can't tell, but I lost a little hair in my through my years. And for me, that has shown up as mercury and fluoride. So one of the most profound things I remember, most consistent things I remember as a child, is my mom making sure we took our little blue fluoride tablet, my brother and I, all of our youth. And because the dentist told her, hey, they have cavities. At that time, I was eating donuts for breakfast and dinner and had 2 cavities every 6 months when I saw the dentist. Got loaded up with some mercury amalgam fillings and took fluoride every day. And ultimately, in my 30s, started realizing, wait, what's going on with my hair? And I've been working to bind up that mercury and that fluoride all since. And recently I've found some tools, or I've used some things to internet. You've probably talked about this on the podcast, I would assume, but those old amalgam fillings that fortunately are not used as much anymore. But for those of us that are older to have those, they vaporize every time we chew. And that mercury vapor tends to be very neurospecific and very prone to hang out in the brain. And so if a person tries to detoxify and do DMPS or EDTA to bind up that mercury and get that out, unfortunately, a lot of studies have shown that may take it out of the blood, and they see a new blood test that shows less mercury. Hey, victory. But that mercury has also often been deposited in the brain at that point. And so it's a little tougher to get out of the brain. But there's herbs, and we can be a little bit more intentional. I find lithium as a mineral is a nice mineral to help facilitate liver detoxification, facilitate bringing the mercury out of the brain tissues. So lithium, and think lithium deficiency, that's hit a lot of press with bipolarness and the consequences of that, or the benefits of using that to stabilize mood. I think a dentist earlier on had the highest suicide rate because they were breathing the mercury all the time. So lithium is a good way to help facilitate that. Molybdenum, the mineral MO, molybdenum, is another one that helps facilitate the key pathways to get some of that mercury out. And we also so those are ways to bind up the mercury. And then there's some herbs that I recently started on a product by standard process called NeuroRegenX that works good for concussions. I'm an active cyclist, and I landed on my head a few times. So between that and the mercury, taking this NeuroRegenX has helped my brain. And the profound thing I notice is when I get home, that brain fatigue at the end of the day after working with patients all day long, it's like I'm done. I want to hang my tongue out and sit on the couch. As I've got my brain working better, it's been pretty profound where I get home and I still want to work. I still want to promote the book and get information out there and share. Just look at that brain fatigue and how long you can stay focused to read a book or that sort of thing. Use that to be an early indicator of how functional the brain is. When we're treating post-concussion patients, that's one of my metrics, is how long can you read before you check out. So we want to at least get to that 20-minute mark. Typically that's the attention cycle anyway. When they first get a concussion, it's like read two sentences and they're looking off to the sky. So use brain fatigue as an early indicator to keep that functioning so we don't have to go down the ugly roads. So that's the mercury aspect in the brain. And then the fluoride aspect. Fluoride competes with iodine. That highlights it will compromise thyroid function. So if we have fluoride, which unfortunately is in the water, hopefully RFK is going to get some of that out for us. But that will compromise thyroid function. That can set up the tension headaches and the tension on the back of the head. Look at reducing fluoridated toothpaste and your municipal waters that have fluoride. Unfortunately, one of the only ways to really get the fluoride out of municipal water is reverse osmosis, which tends to take too many minerals out, which then could potentially alkalize us. I came to this as personally, I had an RO system at my house, and I'm like, ooh, I'm dehydrated. I downed a bunch of water, and my lips would get more chapped. I'd feel more parched. And then I'd use my spring water at the office. I drink 2 ounces. Oh, I'm rehydrated. So that kind of got me on that rabbit trail of looking at water purification and so on. So I've leaned into now looking at RO systems to get all the junk out, but then we have to remineralize and re-energize that water to keep those minerals in our bones, in our teeth, to keep us alkaline so that we can keep the calcium in our bones and not floating around plugging up the arteries and so on. So good fats, to circle back to the gallbladder thing, eating the good omega-3s and so on, keeps that gallbladder pumping so that we can minimize hiatal hernias and right-sided headaches, keep the calcium in the bones. But again, using water that's clean and healthy, doesn't have that iodine, which would have potentially compromised the thyroid. Mm-hmm.
Yeah, that's amazing. I'm fortunate where we live, we do not have fluoride in our water supply, so that's very nice.
I was going to try to inspire you to come move to Southern California, but I guess not now, huh?
I don't think so. I'm staying away from California, I tell you that. We're lucky where we are. We've still got some good freedoms here.
Nice.
But I reached out to the governor of New York. The mayor of Albany wants to fluoridate the water, and this was before a lawsuit came out proving where the federal judge said, hey, there's an unreasonable risk of lower iodine fluoridated water. But I tried to present the evidence, but I got back the line. It's one of the top 10 best public health successes of all time. Oh, such a party line. And I was like, and not based on real science. And you said you were taking fluoride as a kid, but every time you went, you had 2 cavities. So it's really not, it's not, fluoride doesn't exist in natural teeth. So why should we put it there? What we need are minerals. Right? That's how I'm trying to treat all my patients. If they are, more susceptible to decay, I'm thinking, what's going on in the digestion, right? What is the stress level? Even kids can be stressed out and not make enough stomach acid, right? And then not absorb the minerals and have all sorts of issues, create more of the reactive oxygen species, which changes the fluid flow direction in the teeth. People don't think of teeth as an organ, but every single tooth as an organ has its own blood, its own lymph, its own nerve supply. And we need to treat it like any other organ, right? We need to give it the nutrients. The other thing people don't realize is that teeth are mineralizing and demineralizing all it's possible. There are some dentists were sometimes trained, oh, you see that little dark spot on the outside, boom, we better cut open the tooth. Well, again, it's a dynamic process. Once you cut into a tooth, it's forever. We haven't figured out quite how to replace the enamel. I'm sure it'll come, but it's not here yet. So my philosophy is always, okay, let's talk about diet. I've recently created this new remineralizing paste. I was listening to one of the more holistic organizations said, hey, you never have to drill again. I was so excited to listen to this webinar. And it was all about silver diamine fluoride. And it was speechless. I could not believe that they were talking about this. And sure, it stops the cavities because fluoride is an antibiotic, right? It kills the bacteria, but it also stains the teeth black, which is not very aesthetic. What else? What do we really need to stop cavities? We really need minerals, right? We could use silver. You got to be careful, right? I don't really like colloidal silver anymore. But I've created my own little paste. I'm like, all right, I've got a couple of patients who are experimenting with this and see what happens. Some patients get those white lesions after braces, right? I don't want to have to cut into all of that enamel, put plastic all over these people's teeth. Yeah, maybe plastic is better than the mercury amalgam, but is it? So I'm like, I only want to put in this foreign material if I absolutely 100% have to. If I've tried everything else and the cavity is getting bigger, because the last thing I want is somebody to need a root canal, more invasive dentistry. But again, the body has an amazing inherent ability to heal if we take away the burdens, give it what it needs. So, that's always kind of been my philosophy with that there. So
Tell the world, please. Yeah, I hope everybody got what you just said, that teeth are dynamic. They're a tooth. And for me, as a clinician, is it teeth that is a problem? Is it a tooth? If it's a tooth, we need to look at the organ association that's compromising that tooth. Heal the organ, and the tooth pain will go away when we do the right thing. How many times are you the dentist? There's nothing wrong with the root. There's nothing wrong with the tooth. I don't know what they leave people with no answers at that point. So learn from what the body's trying to tell you. It's a motivator.
We're coming up to 10 here. Is there anything, you've given us so much information, is there anything else you'd really like on your heart that's in your head that you really want to share with the audience for us today?
Just to capitalize on what we've both been preaching all along. The pain is intended to elicit change. Learn from what your body's trying to tell you, whether hopefully the practitioner you're associated with has the answers. If not, keep searching to find those answers. Bring it back to the practitioner so maybe they can help the next person that has it. We're all a community. Let's grow and learn together. Stop masking the problems. Stop band-aiding, covering things up, and learn from what our bodies are trying to tell us. Praise you, Doc, for sharing this and getting this information out. It's working. You've grown a great reach in a short amount of time. So people are eating it up. They want to get to the root. That's fantastic. So thank you for what you're doing.
Thank you. And so tell us about your book and website, how we can connect with you if we want to learn more.
Thank you. Last name is Vrzal, V as in Victor, Rzal. So I'm on most of your social media platforms. If you can spell the name, you can find me. The book is The Headache Advantage. Again, advantage because we can learn from what the location of the head pain. So but headacheadvantage.com is the website. And the book is on Amazon. Fortunately, it's there in hardcover, softcover, electronic version, and soon to be released in audio. I listen to books while I exercise and run. That's how I can get 15, 20 books a year digested. Yeah, I'll try to make it available for you in all the different formats.
Well, I can't wait to get a copy of that, because that's how I like to learn too. Audio, listening to the podcast and reading. So I'm excited to dive a little bit deeper and learn all these connections. So I so appreciate your time to me. I often have people on with subjects that I kind of know a lot about, and I really appreciate how much you taught me today, so that I can, like you said, I can bring that to my patients and, on the podcast, help, teach other people, because that's what it's all about, really. It's about working together. It's about partnering with our patients and just helping the world to be a better place. So thank you so much for taking time today to share all your knowledge and wisdom. with us. And I hope we keep in touch. I look forward to learning more from you.
Let's do more. Appreciate what you're doing. Thanks, Dr. Carver.
Thanks, everybody. I hope you enjoyed this episode. Again, check out Dr. Vrzal's book, The Headache Advantage, and we'll see you guys all on the next episode. Hello, I'm Dr. Rachel Carver, a board-certified naturopathic biologic dentist and a certified health coach. Did you know that over 80% of the U.S. population has some form of gum disease? Many of us don't even know that we have this source of chronic infection and inflammation in our mouth that's been linked to serious consequences like heart disease, diabetes, stroke, dementia, colon cancer, kidney disease, even pregnancy complications. Would you like to learn how to reverse and prevent these chronic debilitating conditions without spending a lot of time and money at the dentist? Join me for my 6-week course where I will teach you the root cause of disease. You'll learn how to be your own best doctor. Are you ready to get started? Let's go.